The bar chart to my right. You have two groups. The timing of this particular study was between September 24th, 2020 and December 21st, 2020. Keep those dates in mind because it's real compelling as to when the study took place and how long it took the information to surface to your purview. What are you looking at? Nasal irrigation. Now, I know it sounds innocuous and fairly simplistic, but the group that you see in nasal irrigation right there, they either basically use nasal irrigation twice daily and as a high-risk group of individuals that tested positive for COVID-19 back at that time in 2020, when the variants of concern had a very high mortality rate compared to the variants of today. So that even makes it more compelling. But what do you see? Nasal irrigation, twice daily, either an alkalizing solution and povidone-iodine. What do you see missing? Mortality, death. You see the legend at the top there? Now, what's the 9.5%, 1.5% represent? The average mortality as represented by CDC data at that particular time. What's the 1.3%? In the prospective test groups, which are all 55 and older, tested positive for COVID-19, had other comorbidities such as hypertension or obesity, which was a highly vulnerable group at that time. Just 1.3%. No mortality, 1.3% hospitalization. For a very, very, very simple, I don't want to use any words that potentially can get us censored, but simple method. And with that in mind, let's get right into the research. And I also want to reiterate the temptation to diverge off course in reference to this incredible outcome as to why this data did not surface to the public sooner is open for debate. But my objective here is just to get you the results of the outcome. The debate as to why the information did not surface sooner, we all have our speculations. To proceed, twice daily nasal irrigation reduces COVID-19 related illness and death. The study was produced by the Medical College at Georgia Augusta University. Starting, twice daily flushing of the mucous Lyon nasal cavity with a mild saline solution soon after testing positive for COVID-19 can significantly reduce hospitalization and death. Now, that's an interesting aspect too. This is going to be a real great observation. If we are not censored or this video is not removed after 6 weeks, then that means we've matured as a society in regard to information being allowed to be presented to you. If we are censored or the video is removed per se, then that means we really haven't matured yet. So I really encourage you to come back in about 6 weeks to see if this video is still here. To proceed, quote, you ready for this? They say the technique that can be used at home by mixing a half teaspoon each of salt and baking soda in a cup of boiled or distilled water, then putting it into a sinus rinse bottle is a safe, effective, and inexpensive way to reduce the risk of severe illness and death from coronavirus infection that could have a vital public health impact. That paragraph alone, if I was to say that a year ago, this video will only be out there for about a week before being pulled by fact checkers, which really don't know anything about facts. So keep in mind, this is a documented DOI citation study that has been peer-reviewed and released in public science journals. To proceed, and please forgive me if I reemphasize that from time to time, but in order to maintain this information in the public spectrum, sometimes those disclaimers need to be repeated quite often. To proceed, in fact, this is the observation in the backstory. In fact, nasal irrigation is something that's been done for millennia in Southeast Asia. And Baxter, the researcher, had noted lower death rates from COVID-19 in countries like Laos, Vietnam, and Thailand. Remember when we did our data analytic reports, for those familiar with Python, and we could not figure out why a lot of these Asian countries, the mortality rates were so incredibly low? Well, a lot of people assume, well, it must be masks or whatever it is. And who knows? But there's some confounding here because the daily habits go beyond just anybody wearing a mask. To proceed, those places that, quoting the researcher, that I knew from having been there where they use nasal irrigation as a normal part of hygiene, just like brushing their teeth. You can see where the confounding comes in. She says, a 2019 pre-COVID study provided evidence that regular nasal irrigation in Thailand can improve nasal congestion, decrease post-nasal drip, improve sinus pain and headache, improve taste and smell, and improve sleep quality. The results, quoting, we found an 8.5-fold reduction in hospitalizations and no fatalities. Remember the bar chart we said in the beginning? Compared to our controls. Says the senior author, Dr. Richard Schwartz, chair of the MCG Department of Emergency Medicine, Medical College of Georgia. But quote, both of those are pretty significant endpoints. Understatement. To proceed, the study appears to be the largest prospective clinical trial of its kind, and the older, higher-risk population they studied, many of whom had pre-existing conditions like obesity and hypertension, may benefit from these easy, inexpensive practice, the investigators say, which is interesting because during the whole pandemic phase, there was a study that came out where they're using some sort of iodine nasal irrigation. And the researchers looked at that research and said that basically it was insignificant or non-significant outcomes, meaning depending on what the null hypothesis was, they couldn't prove it made a difference. But the researchers looked at that, and this is supposed to be a randomized clinical trial that governments are basing their policies upon. They noticed a 23-year age difference between the control group, meaning the control group was much younger, and the treatment group was much older, bringing into severe question the randomization in reference to that study utilizing nasal irrigation. But to proceed, let's stick with the study itself. They found that less than 1.3% of the 79 study subjects aged 55 and older who enrolled within 24 hours of testing positive for COVID-19 between September 24th and December 2020 experienced hospitalization, and no one died. So to make it sound more fluent, 1.3% experienced hospitalization, did the nasal irrigation twice daily, and there was no mortality. To proceed, by comparison, 9.4% of patients were hospitalized and 1.5% died in a group with similar demographics reported by the Centers for Disease Control and Prevention during the same time frame, which began about 9 months after SARS-CoV-2 first surfaced in the United States. The reduction of 11%, and people are going to go, where's this 11% coming from? Well, 9.4% and 1.5%. To 1.3% as of November 21st. This is a very profound statement by the researchers, and they're saying it quite diplomatically, but let it sink in. Would have corresponded in absolute terms to over 1 million fewer older Americans requiring admission. They write, and that's, think about mortality and everything else along those lines. It's profound. That's why it's tempting to go off subject and make it a debate about something else. But I really want to stick with the outcome here and help those who are still here today. And we'll learn from those mistakes in the past. Proceed. If confirmed in other studies, the potential reduction in morbidity and mortality worldwide could be profound. Quote, end quote. Now, here is the telling statement by one of the researchers. As far as what, remember, this is our show now, 1101, and people don't realize coercion happens an incredible amount in the research community. And here's the coercion that they experienced. And the frustration, knowing that they can help literally millions of people by a simple methodology, had to be one of the most frustrating things that these researchers could have experienced, sitting back, seeing all of this mayhem, knowing that potentially their research could have made a difference. To proceed, Baxter noted, the skepticism of the medical community before the results could even be peer-reviewed and published, and her frustration with this relatively simple approach not being used when so many were sick and dying. Again, I'm not going to diverge or go off course. Let that sink in and basically come to your own conclusion. Now, additionally, how does this work? Well, you hear about a lot about vaccines utilizing nasal irrigation, or not nasal irrigation, apologize. The mucous membranes in the nose being so important, and a lot of vaccines being focused on this aspect. But to proceed, that just gives you a little hint. The now infamous spiky SARS-CoV-2 is known to attach to the ACE2 receptor, which is pervasive throughout the body and in abundance locations like the nasal cavity, mouth, and lungs. Drugs that interfere with the virus' ability to attach to the ACE2 have been pursued, and Baxter says that nasal irrigation with saline helps decrease the usual robust attachment. Saline appears to inhibit the virus' ability to essentially make two cuts in itself called furin, cleavage. Hope that pronounce that furin. So it can better fit into the ACE2 receptor once it spots one. So basically, it inhibits the virus, may inhibit the virus from being able to cut itself to this furin cleavage, and fit into the ACE2. So basically, it's a very simplistic Occam's razor. If it's simple, it works. Why overcomplicate it? And of course, that's what the researchers are trying to get at. But to proceed. So that's the hypothesis we want to utilize in reference to what the researchers are basically trying to say, why this may do what it does. The methods. I want to go into the methods because this goes exactly into how it's done in the study. I know the first part it said basically half a teaspoon each of salt and baking soda, a cup boiled or distilled water, so on and so forth. But let's look at the methods of the study itself, because one of the methods really had an interesting outcome as well. Participants 55 and older were enrolled within 24 hours of a positive PCR COVID-19 test between September 24th and December 21st, 2020. Among 826 screens, 79 participants were enrolled and randomly assigned to add either 2.5 milliliters of povidone-iodine, 10%, or 2.5 milliliters of sodium bicarbonate to 240 milliliters of an isotonic nasal irrigation twice daily. COVID-19 symptoms resulted in one emergency department visit and no hospitalizations in the 42 irrigating with alkalinization. So think about that. Resulted in one ED visit, emergency department visit, no hospitalizations in the 42 irrigating with alkalinization. One hospitalization of 37 in the povidone-iodine group at a 1.2% and no mortality. Now, again, to be profound, there wasn't so much coercion back then in regard to studies like this. Outcomes could have been very different. Proceed. A study released in 2020 indicated, now we're going to go to the conclusion. Just they're going to give a side note of some of the other studies that basically were corresponding with theirs at the time, which is fair. A study released in September 2020 indicated that gargling with a saline-based solution can reduce viral load of COVID-19. And another release in 2021 suggested that saline works multiple ways to reduce cold symptoms related to infection with other coronavirus that might work as well for the first-time interventions for COVID-19, which obviously they elucidated in regard to the study. Despite two nostrils, the nasal sinus is just one cavity. So the water is pushed into one side and comes out the other, noting the researcher. Again, this is going to be interesting. Now, I want to take it all out of the way first. So what's going to be interesting about this is as follows. So what we want to look here is I seriously encourage you to come back in 6 weeks. If the video is still posted, then yes, the conversation in regard to basically research into improving the outcomes in regard to COVID-19 may have matured. If this particular study, for example, is censored, that means we're not at that level of maturity as of yet. But you saw the quote from the researcher, how it was difficult even to get the research acknowledged, and people were shooting it down even before peer review. You talk about bias. So all because someone says they're a researcher or a medical doctor, whatever it is, if they're biasing research before they even look at the study itself for peer review, that really gives an interesting look at the dynamic. So, just the same, you got to give these researchers credit, because the bravery to stand on your own and stand for the truth that you represent in regard to data which you have the outcome of that knows it could benefit tons and tons of people is quite incredible. I know the methodology and what they did was fairly simple, and it needs to be replicated. But the interesting part about it is if they would have had this information published back about a year ago, there would have been time to look at it again and see if they can replicate these studies. They're fairly fast studies. Think about it. All you're doing is pulling in people with positive PCR test, and then you're using nasal irrigation and check what the outcome is. It doesn't take years to conduct this study. It's only something that literally takes just a few weeks, and then waiting 28 days to make sure there was no other complications that could be involved. It's something that's really easy. They could even do it today. In fact, now that the study's been published today, it'd be incredible from other college or research institutions to say, hey, let's just see if it works. The instructions are right there. But again, gratitude for these researchers for doing what they did in the face of such incredible peer pressure in regard to not doing something like this. That's bravery. And again, I am humbled to watch. This is show 1101. And yeah, I know it sounds like a lot, but however, our first show was published on February 9th, 2009. And so you're going to see me start using the show number, so it's easier for you to reference in case you forget. You just go back to show number 1101 or episode 1101. Again, gratitude, thank you. Open the debate in regard to scientists having to speak in something called circumlocutions, which is a term that you used back in the 17th century. You read a book called Comte de Caballos. They had the same problems centuries ago as we do today. So in reality, history repeats quite often. Catch you all next time. See you there. Bye.